In this presentation, I'm going to be talking about our selection process. There is a separate presentation which goes into great detail about our academic entry requirements, and so although I touch on that in this presentation, I'm not going to go into any detail here. To recap, we have 2 medical degree programmes available for students at Lancaster. A100, which is the standard 5-year programme, and A104, which is our 6-year programme which has an initial gateway year. What are we looking for? Well, medical students and future doctors have to have a range of academic and non-academic skills. We're looking for the sort of person you might want to go and see when you're not feeling well, somebody who's thoughtful, caring and compassionate. We're looking for applicants who have some insight into what a medical career might mean for them, and also have some insight into themselves. What skills do they have that will make them a successful medical student and be suitable to be a doctor in the future? Our medical students are trained within the NHS, and most of our graduates will work within the NHS. Everything that the NHS does is underpinned by a set of shared core values. And so we're looking for applicants to demonstrate that they understand what those values are and how they are embodied in clinical practice. We have a 4-stage selection process at Lancaster, trying to select applicants who have demonstrated those attributes. So stage 1 is academic excellence, where we're looking at your achieved and predicted grades. The vast majority of our applicants will meet our academic entry requirements, and so we use the biomedical admissions test as an independent indicator of academic aptitude to differentiate between applicants and decide who is invited to interview. Stage 3 is the interview, which is performed using multiple mini interviews, and that is used to assess the non-academic skills that we're looking for in our medical students and future doctors. And the final stage is fitness to practice. If you want to apply to A104, you have to meet 2 additional eligibility criteria. I've given you some examples of those eligibility criteria on this slide, but you should look at our website for full details of all the criteria that apply. So examples of eligibility criteria might be if you come from a low income household, if you attended a non-selective state school for your GCSEs and that state school had an attainment 8 score that was below the national average, if you're the first person in your family to go to university, your mum and dad don't have degrees, didn't go to university, or you might be a care leaver, a refugee, or a young carer. So those are some examples, but as I said before, please look at the website for full details of the criteria that apply. Stage 1, academic excellence. So as I said, we have a separate presentation that goes into detail about the academic entry requirements, so I'm just going to touch on that here. We accept a wide range of qualifications, and we're looking for excellent grades across the board in both any qualifications you've already achieved, and if you're applying with predicted grades, looking for excellent predicted grades as well. You can either consult the other presentation for details of that, or you can look at our website where you'll be able to find detailed information about our academic entry requirements. Stage 2 is the biomedical admissions test. The BMAT comprises 3 different sections. Section 1 is thinking skills, Section 2 is scientific knowledge and applications, Section 3 is a short writing task. In Section 1, the format of questions, generally you're given a section of text to read and then some questions to test your ability to comprehend, interpret and understand that text. Section 2 is testing your GCSE science and maths, but the format of the questions will be very different from the questions you were asked at GCSE. It's much less about factual recall and much more about being able to apply that knowledge in a different context to answer those questions. As I said before, Section 3 is a short writing task. You tend to get the choice of 4 or 5 different topics to choose from. These tend to be topics which are related to medicine but not to the science elements of medicine. And we're looking for you to be able to sort of develop a logical argument. It's not a massively long essay, it's just one side of A4 and perhaps looking for you to put both sides of the argument. What do you agree and why? To calculate your total BMAT score, we add up the scores for sections 1, 2 and 3, and then applicants are ranked according to their BMAT score, and anyone who meets our academic entry requirements and has one of the top ranking BMAT scores will be invited to interview. We don't operate an absolute cut-off in terms of BMAT score. The score that will get you to interview will vary year on year depending on how many people apply and how good a score they have. There are some key dates for BMAT. So you have to register for BMAT, and that's separate from registration for UCAS. Registration opens on the 1st of September, and if you want to pay the lower registration fee, you need to register before the 1st of October. You can still register between the 1st of October and the 15th of October, which is the UCAS deadline. You have to then pay an additional late fee. The test date this year will be the 4th of November, and applicants and medical schools will receive the results at the end of November on the 27th. So how might you prepare for BMAT to make sure you get the best possible score? We recommend that you use the free resources available on the BMAT website. There are practice papers, worked examples, and examples of Section 3 writing tasks. So we recommend that you familiarise yourself with the question formats. They're going to be quite different from questions you've used in the past. We also recommend that you review the Section 2 guide. So Section 2, as I said before, will cover GCSE science and maths, but different exam boards cover slightly different topics in their syllabus. So the Section 2 guide will tell you what topics you can expect to be covered in Section 2 in the BMAT. So familiarise yourself with the format of questions and then practice doing all 3 sections. And we recommend that you at least a couple of times practice those sections under timed conditions to see how you will manage to perform under those quite time-stressed conditions. And finally, we recommend you spend about 30 hours preparing for BMAT. The only exception to that might be if you're a mature student and it's quite a long time since you did GCSE science and maths. You may want to review Section 2 guide and do some revision before you actually practice doing the paper itself. So the next thing I want to talk about is what kind of BMAT scores might enable you to be invited to interview at Lancaster. So I've given you here 3 graphs that show you the spread of scores for sections 1, 2 and 3 in the BMAT that was taken in 2018. One thing that I think A-level students find quite difficult to get their head round is that normally when you've been doing GCSEs and A-levels, you're looking for the very top scores to get those A and A-star grades to get you into medical school. But with BMAT, very, very, very few people get those very top scores. And actually, if you get a totally average score of about 5 in sections 1 and 2, you're doing pretty well. At Lancaster, typically a score of 4 in sections 1 and 2 and a score of greater than 2.5 in section 3 would be sufficient to get you to be invited to interview. So that gives you an idea of how much of the test you need to be able to answer correctly. You don't have to answer every single question correctly, and to get a score of about 4, you probably need to be able to answer about 40% of the questions correctly. And this is because BMAT is designed to be challenging and stretching, because we're trying to spread out applicants who are all doing well academically. They've all got good GCSEs and they've all got predicted good grades at A-level. So BMAT is designed to be stretching. You don't have to be able to answer all the questions correctly to be able to get into medical school. So I said before, ranking according to your total BMAT score determines who gets to interview. At interview, we use multiple mini interviews to assess your motivation to study medicine, your understanding of your chosen career, and also your personal skills, values and attitudes. And finally, we're looking to test your communication skills, because that's a key skill that all doctors need. In multiple mini interviews, applicants are asked to perform a range of different tasks, and I'll give you some examples of those on the next slide. Generally, you're spending 5 minutes at each station, plus we also include a 20-minute group work exercise in our multiple mini interview. Those stations will include a mix of preparatory and assess stations. So in the preparatory stations, you might be asked to read something, think about some questions. You have some time to compose your answers, and then you go on to discuss with an interviewer at the next station. There's also some break stations in our circuit, so that's just a station where applicants can take 5 minutes out of the process to relax and perhaps compose themselves if maybe some of their stations haven't gone to plan. Your performance at each of the stations is assessed against clearly defined criteria that are really about the skills we're testing in that particular station. At Lancaster, you will generally be assessed by 10 different assessors or interviewers independently. And although that might sound quite daunting, what it actually gives you is 10 independent opportunities to impress and demonstrate that you're suited to studying medicine. So that means if you do have an interaction with an interviewer that you don't feel went very well, you didn't understand what they were asking you, or you didn't feel as if you answered their questions terribly well, it's not the end of the world, because you have 9 other opportunities to impress within our selection process. So examples of MMI stations, there will always be something where we're probing your understanding of your chosen career. We do that in different ways every year, and what I will say to you is Please don't come with a pre-prepared spiel about your work experience, because that generally doesn't answer what we're looking for. So you need to listen to what the interviewer has said and be prepared to answer those specific questions rather than just give a general description of the work and voluntary experiences that you have undertaken. On this slide, I've given you a couple of examples where we would have a preparatory station. So there's always something about medical ethics in our multiple mini interview. On that preparatory station, you'll maybe be given a short statement about a current issue in medical ethics, maybe a couple of questions to get you to think about both sides of the argument, 5 minutes to think about what you think, and then 5 minutes to discuss with an interviewer at the subsequent station. With these stations, there's no right or wrong answer. We're looking for you to articulate what it is that you think and why. The second example of a multiple mini interview station with a preparatory station is one where you might be given a piece of data to look at. So it might be a graph or it might be a table of data. Again, 5 minutes to review that data, 5 minutes to think about it, and then you go on to discuss with an interviewer at the second station. I mentioned before that we have a 20-minute group work exercise as part of our selection process, and that's really mimicking problem-based learning and assessing your suitability for our problem-based learning curriculum. Final example I've given you here is one of our communication skills stations. So we have a group of patients and public representatives that work closely with the admissions team. And on this station, you're just asked to interact with one of the people from this group. So they're just a member of the public. And we're looking at how you ask them questions and how you respond to what they tell you in conversation. So it's not an actor, it's a real person giving you authentic answers to the questions that you ask. So in the multiple mini interview, I said you're assessed by 10 different people. They will each give you a score, and at the end we'll add up all of those scores, and applicants are ranked according to that total score. Generally, at interview, we're making offers to the top 50 to 60% of people who've been invited to interview. So if you're invited to interview, you've got about a 1 in 2 chance of being made an offer after interview. The last stage of our selection process is fitness to practice, and it has 3 different elements. The first is probity. So obviously, acting truthfully and with integrity is absolutely key to the medical profession. And so we take probity extremely seriously during our selection process. And if we discover that applicants haven't been 100% truthful in the information they've provided, for instance, if they've talked about something in their personal statement that they haven't actually done at the point of application, then we reserve the right to not make them an offer, even if they have been successful in other stages of our selection process. The second aspect of fitness to practice is about your health. So we need to make sure that you being in clinical practice isn't a danger to your health and that your health condition isn't a danger to patients. And there's a couple of ways in which we do that. If you have any disabilities or health conditions, you're asked to declare that at the point of application. We don't really take that into consideration unless you've been successful and are in line to get an offer. In that case, we'll then perhaps ask an occupational health professional to assess your disability and health condition and make sure that you're fit to practice. Generally, what we're looking for here is what reasonable adjustments does the medical school need to put in place to allow you to study effectively. The second aspect of health is that medical students have to be immunised against a range of different infectious diseases, and that's to make sure that you don't pass infection on to patients when you're on wards or in GP practices, but you're also not in danger of catching those infectious diseases in those clinical environments. The final aspect of fitness to practice is criminal background. So when you're invited to interview, you're asked to complete a declaration of your criminal background, just to say that if you have any criminal convictions, cautions or warnings or reprimands, that you tell us the context for that, the incident, and a bit about reflecting on that incident. And then that will be assessed by a fitness to practice panel to determine whether that conviction, caution, warning, reprimand has any impact on your fitness to practice. So again, this is not considered unless you're in line to get an offer, and if we need some additional information from you, we will contact you after interview. In general, the sorts of things that we have seen before have been perhaps drunken disorderly, shoplifting, and none of the criminal convictions that we've seen so far have been a bar to students getting into medical school. Once you get to medical school, you have to undergo an enhanced disclosure and barring service clearance, and that will mean that any convictions that you do have will then be brought to light during that process. So if you haven't declared them during the admissions process and it comes to light once you're a student, that would then trigger another fitness to practice panel to discuss whether that has any impact on your ability to remain a student. So a number of things that are put in place towards the end of our selection process to make sure that the students that we admit onto the programme are fit to practice. So completing the UCAS form, if you want to apply to medicine, you have to apply before the 15th of October. If you want to apply to Lancaster, L14 is the institution code. And then there are the two programmes, A100, the 5-year programme, and A104, the medicine and surgery programme with a gateway year. You shouldn't apply to both of those because if you're eligible for A100, you're not going to be eligible for A104 and vice versa. On your UCAS form, you have space for 5 choices and 4 of those can be medical degree programmes and the 5th is reserved for a non-medicine course, maybe biomedical science or something as a backup choice. Thank you for listening today. If you've got any questions, you can email us on medicine@lancaster.ac.uk and we'll endeavour to answer your questions. Thank you. We have 2 medical degree programmes here at Lancaster, the standard 5-year programme A100 and our 6-year programme A104, which is medicine and surgery with a gateway year. And I'm going to cover the academic entry requirements for both of those programmes today. What are we looking for at Lancaster? So we're looking for well-rounded individuals who have developed the academic and non-academic skills that you need to be a successful medical student and a future doctor. We're looking for the sort of people you might want to go and see if you're not feeling very well, somebody who's thoughtful, caring and compassionate. We're looking for applicants who have insight into their chosen career and also insight into the skills they have that might make them suitable to be a doctor in the future. Our medical students train within the NHS and the vast majority of our graduates will work within the NHS, and everything the NHS does is underpinned by a set of shared core values. So we look for applicants to demonstrate that they understand those values and how they are embodied in clinical practice. You have to be motivated and conscientious to get into medical school. You have to be motivated and conscientious to get through medical school, and you have to be motivated and conscientious to survive in a medical career. So we look for that in our applicants. You need to be academically able because we're going to expect you to learn and master a wide range of knowledge and skills. And finally, you need to be a resilient individual. Studying medicine is challenging and being a doctor is a challenging career, and we need to select applicants who can demonstrate they have the skills to be able to cope with those challenges. We have a 4-stage selection process. So in this presentation, I'm really only going to be focusing on stage 1, academic excellence, but you have to understand that even once you've met stage 1, the academic entry requirements, there are 3 more steps before you can be successfully admitted to Lancaster. At stage 1, we're going to look at predicted and achieved grades, and we're looking for excellence across the board. The vast majority of our applicants will meet our academic entry requirements, and so we use the biomedical admissions test at stage 2 as an independent indicator of academic aptitude to decide who should be invited to interview. Stage 3 is our interview process, which is performed through multiple mini interviews, and the final stage is fitness to practice. And as I said before, we have another presentation which goes into the selection process in more detail. This presentation is simply about the academic entry requirements. So most of our applicants for A100, the 5-year programme, are coming straight from school with a combination of GCSEs and either A-levels or the International Baccalaureate. At GCSE, we expect you to study 8 subjects, and we will look at your best 8 subjects, but those best 8 have to include English language, maths, biology, chemistry and physics, or core and additional science if you haven't taken the 3 separate sciences. We use a scoring system where A or A star or GCSEs at grades 7 to 9 are awarded 2 points. GCSEs at B or grade 6 are awarded 1 point. And then we look for at least 13 points from those best 8 subjects. So that's what we're looking for at GCSE. At A-level, if you're studying 3 A-levels alone, the standard offer is 3 As. If you're taking a 4th AS level, a 4th A-level, or an APQ alongside your 3 A-levels, then the standard offer is 2 As and a B in those 3 A-levels, plus a B in that 4th subject or APQ. If you're taking an international baccalaureate, the standard offer is 36 points overall, plus 6 in 3 higher level subjects, plus 5 in 3 standard level subjects. At A-level or at higher level, we look for 2 subjects from biology, chemistry and psychology for entry to A100. The contextual offer is an initiative to increase diversity in the medical profession, and it recognises that certain groups within our applicants face additional barriers to achieving the academic entry requirements. You should consult our website for full details, but on this slide I'll give you the bare bones of what we do for the contextual offer. So to be eligible for the contextual offer, you must be predicted at least 2 As and a B in your A-levels or the equivalent in IB. Plus you must fully meet our GCSE requirements for A100. If in addition you meet 2 eligibility criteria, so for example you're from a low-income household, you attended a non-selective state school for your GCSEs and that school had an attainment 8 score that was below the national average. If you're the first person in your family to attend university, so neither your mum nor your dad went to university straight from school, or for example, if you're a care leaver or a young carer, those are the sorts of criteria that we apply for the contextual offer. And as I said before, you need to meet 2 criteria. Full details of the criteria can be found on our website. So if you're predicted 2 As and a B, fully meet our GCSE requirements, and to meet 2 of these eligibility criteria, you'll be made a dual offer. You'll be made the standard offer that you would have got if you didn't meet these criteria, so for instance 3 As at A-level, plus the contextual offer, an A and 2 Bs. The contextual offer is dependent upon you making us your firm choice on UCAS. If you're taking the International Baccalaureate, the standard offer is 36 points overall, with 6 in 3 higher level subjects plus 5 in 3 standard level subjects. In this case, the contextual offer is 32 overall, achieving 5, 5 and 6 in 3 higher level subjects. So that's the details of our contextual offer. We don't have a graduate entry programme at Lancaster, but graduates are eligible to apply to our standard 5-year undergraduate programme. If you apply as a graduate, there are entry requirements at GCSE, A-level and degree level. What's required at A-level will depend on what subject you're studying for your degree, so please consult our website for full details of these entry requirements. But regardless of what you're studying at university in your first degree, you have to achieve at least a 2-1 or the equivalent with an academic transcript mark of 65% or greater in the UK. That would equate to, for instance, a cumulative GPA of 3.5 out of 4 in other countries. We also accept a wide range of other qualifications from around the world. Please consult our website for further details of the entry requirements for other qualifications. If you're applying from outside the UK, or if you're in the UK for less than 5 years and English is not your first language, then we have some additional English language requirements. In common with all applicants, you need to have studied English at GCSE or IGCSE, and we only accept first language English GCSE qualifications. But if you are applying from outside the UK, or if English is not your first language, we also expect you to take one of the following. You either need to take IELTS and achieve at least 7 in each component, or you need to take Pearson PTE and achieve at least 70 in each component. So that's additional English language requirements if you're applying from outside the UK or if English is not your first language. So like the contextual offer, A104, our Gateway Year programme, is trying to attract a wider range of applicants to study medicine so that we can increase diversity within our medical students and within the medical profession. Not everyone is eligible to apply to A104, the Gateway Year. You have to meet 2 of the eligibility criteria before you can be considered for this programme. So again, I've given you some examples on this slide, but you should consult the website for full details of the criteria that can be used. The eligibility criteria are similar to those that apply for the contextual offer. For example, if you come from a low-income household, if you attended a non-selective state school with an attainment 8 score that's below the national average, if neither your mother nor your father attended university, if you're a care leaver or a young carer. So you must meet 2 of these eligibility criteria before you can be considered for A104, the medicine and surgery with the Gateway Year. If you do meet these eligibility criteria, it means that you can be considered to study medicine with lower GCSE and A-level requirements. So at GCSE, we're still looking for 8 subjects, although if you have studied fewer, then we will still consider you. All your GCSE subjects must include English language, maths, biology, chemistry and physics, or core and additional science if you haven't studied the 3 separate sciences. And all of those required subjects at GCSE must be achieved at least grade 6. The same scoring system applies as does for A100, where GCSEs at A star or grades 7 to 9 are awarded 2 points, and GCSEs achieved at B or grade 6 are awarded 1 point. We then look for applicants to the A104 programme to have achieved between 9 and 13 points from those best 8 subjects. So that's slightly lower GCSE requirements than for A100, our main programme. At A level, the standard offer for A104, the Gateway programme, is an A and 2 Bs, although we often confirm on lower grades than that, for instance 3 Bs or ABC. And in the International Baccalaureate, the standard offer is 32 points overall, including 5, 5 and 6 in 3 higher level subjects. The other thing that's different about the Gateway programme is that both biology and chemistry are required subjects at A level or at higher level in the International Baccalaureate. So that's the entry requirements for A104 Medicine and Surgery with a Gateway Year.